Good afternoon. Welcome to Cornell Keynotes. Today we're covering climate and health. I'm Danielle Eisman, the Associate Director of the Cornell Health Impacts Core, which is the outreach and engagement arm of the Cornell Public Health Program. Joining us today are Anthony Townsend and Arnab Ghosh. Anthony is a Senior Research Associate at Cornell Tech's Urban Tech Hub. He leads the development of multidisciplinary research collaborations and is the author of 2 books. Most recently, Ghost Road, Beyond the Driverless Car. And Arnab is an assistant professor of medicine at Weill Cornell, where he conducts research on climate change and health. In 2023-2024, Arnab was one of NIH's Climate and Health Scholars and is an emerging leader in health and medicine at the National Academies of Medicine. Today, we're going to talk a little bit about climate and health, as well as what are some of the outcomes of Climate Week. So if you're not familiar of the connection between climate change and health, climate affects our health in many ways in terms of the impacts that we're experiencing. For many of us, probably the most relevant or at the top of our minds is extreme heat. So due to a changing climate, we are experiencing more periods of extreme heat and heat waves, which has dramatic effects on our cardiovascular system, our respiratory system. It can impact our productivity. It can impact asthma and allergies. So these changes are happening across the world, and we're experiencing these all in a variety of ways. Another connection between climate and health is the increase in vector-borne diseases. So as seasons are becoming warmer, or as warmer seasons are becoming longer, we're seeing a lot more tick and mosquito activity, as well as more opportunities to interact with vectors such as mosquitoes and ticks, and that leads to an increase in vector-borne diseases. So that's just a snapshot of climate and health, but we'll hear more about some of those impacts, as well as what Anthony and Arnab have learned throughout their time at Climate Week, which happened this past week in New York City. Climate Week is a week-long event that occurs in conjunction with the United Nations General Assembly. And that was how Climate Week originally got started. It was intended to help policymakers meeting at the United Nations for the General Assembly to understand a lot of the climate impacts that we are starting to experience and raise people's attention and awareness about climate change. And now Climate Week has grown into such a big event that it somewhat overshadows the UN General Assembly. So with that, I'd like to start our discussion and pose a question to Arnab. What was your role in Climate Week this year?
Yeah, thanks, Danielle. It's great to be here. And hey, Anthony. This week was my role varied. Sometimes I was a wallflower, just kind of watching what was going on. Other times I had the opportunity to speak about some of the research and some of the policy initiatives that we're undertaking at Cornell. If I ran through the week, I think a couple of the big things that happened for me was Cornell hosted a panel with the Environment Defense Fund. And it was a really interesting panel where we got to listen to policymakers at the federal level all the way down to the city level to see how they're tackling climate change within cities. And we had the pleasure of having Dr. Maxwell Dexter, who is a pulmonologist, and a congresswoman from Oregon. And interestingly, Oregon's been experiencing a lot of wildfires recently, and the health effects, particularly of air pollution from the smoke, is something she spoke quite passionately about. And it was interesting to me because Oregon recently had put forward a proposal to distribute air conditioners and air purifiers, particularly for the Medicaid population, for what we typically call means tested low income Americans who require healthcare. Also, what was interesting was sort of how the data was being used. And so some of the city mayors that we spoke to who were on the panel talked about what do they need to really do their job better, to protect their communities from the risk of heat, the risks of flood. And so we had a pretty robust discussion about that. What was notable was that there was a few data sets that are actually available that mayors have been using to understand particularly which part and which neighborhoods are affected the most. And then using that information, they could deploy and talk about policy that could be deployed into those regions or all those parts of their cities. And I think that was really interesting to me as someone who makes the data, who uses the data, to see that really playing out. And I think another big event that happened was that the National Academy of Medicine had a large session on Wednesday where they discussed some of the bigger issues in climate and health. And I think this reflects, a growing awareness of the importance of climate change and its impacts on health and how ubiquitous they are in terms of, say, the things that you mentioned, Danielle, heat risk, people being affected by extreme heat, the heat season extending, hurricanes and other forms of disasters. They released a large effort which defined a new research agenda for climate and health, which I think is leadership that we definitely need. Such efforts did exist before within the National Institutes of Health, but that's somewhat taken a back seat in the current administration. And so the National Academy of Medicine has moved ahead and proposed a series of research agenda to sort of foment the work. And I think one point that also came up, and I'll pause here after this because I know Anthony has a lot to say, is this issue of AI. And AI came up a lot in this meeting. The benefits of AI, what AI can do for sustainability in healthcare, how it can be used to remove a lot of the extraneous administrative issues that face doctors and the healthcare system, nurses, and alike. But it also presented the flip side. What are the environmental costs of using so much AI? And there was interesting research and ideas that were put forward by qualitative researchers and social scientists, particularly from the data, I didn't know this term, the data center alley, in Virginia, where a lot of these data centers have been made. And what that's done to people's lives, for example, the water use that's being used, and also the energy costs that are associated with it. So it really gave me food for thought. As somewhat of an evangelist of the AI as a tool for climate and health, it gave me pause to wonder, what are the extra costs there?
Thank you, Arnab. I'll probably loop back to that because I've had a lot of questions about that same issue. But Anthony, do you want to share more about your role in Climate Week this year, as well as the Health and Climate Hackathon? Anthony, you're muted.
I'm unmuted now. I wanted to start out just by highlighting that even though, there was definitely a very dark cloud over Climate Week this year, like the total withdrawal of U.S. participation in UN climate proceedings, this was the biggest Climate Week NYC ever. So there were over 1,000 events this year. One estimate I saw was that 100,000 people participated. So I think last year there were 900 events. So, despite those setbacks and those shifts in policy and leadership internationally, New York City is still, I think, the center of a pretty big global network of climate activism. The other thing I think that's important is that I started to notice this 2 years ago. Last year it was pretty clear, and this year it was kind of overpowering, was how pronounced the adaptation conversation is becoming. I think, the scientific consensus that we're going to miss 1.5C if we haven't already missed it, seeing the private sector start to understand the risk, to the economy and to their assets, in addition to all the, risks to human health and well-being that we've seen. there's just, the tanker seems to be turning, and people seem to be focusing on that in some pretty substantial ways. So I try to see that as like a positive development. We have to do both. But it's definitely very, very clear this year. And I think, maybe gave folks some cover to stay in the conversation, even if there was risk in being associated with climate action for them. So my role, I was helping the team from our health tech hub at Cornell Tech, led by Chetan Sarabu, and producing a 2-day hackathon, the Health and Climate Hackathon. It was the first one ever. We had probably 150 people come out to campus on a Saturday morning, which is just, such an inspirational way to start Climate Week. I think the average age there was probably 22 or 23. So if you're feeling worn down by the struggle of climate action, those kind of events will definitely rejuvenate you. My role in that event was twofold. So I helped bring in a couple data providers from the private sector that I was really excited about. The first one was FortiGuard, which is a climate analytics startup from Abu Dhabi. FortiGuard refers to 40 degrees Celsius. So, trying to help give really anybody, but primarily focused on city governments, the tools to do precision urban heat forecasts on like a 10-meter grid. And their model aims at a 2-meter elevation. So basically like, human experience of heat, not surface or like in the upper atmosphere. And I think they're just really exciting company because they're part of this like whole crop of startups and tech efforts like Climate IQ at the New School in New York that are basically using machine learning to like really downscale and expand access to hazard models, so that like things that used to take a supercomputer and a bunch of scientists to run can be done on a laptop. And instead of getting like one prediction of how hot it's going to be or where the storm's going to go or how much flooding there's going to be, a city planner on the coast of Florida can sit and run scenarios all night long on their laptop and use that to help inform them. So we saw, some of the competitors using that really precise, I think it goes 2 weeks out, heat forecasts in their solutions. And then the other provider I was really excited about was System.com. They are a startup based in Soho in New York, founded by the former chief data officer for Spotify. And they are basically crawling like the entire scientific literature every day and extracting in a very structured way the findings. And so what that and healthcare has been their first, healthcare and environmental health are their first kind of target areas. They're working closely with the Mayo Clinic on building that product out. And the way it was used in some of our solutions that the competitors put together, it allowed you to go in and see, what does the literature, all of the literature say in a very mechanistic weighted way, like what the health implications of air pollution or exposure to certain kinds of particulates are. And so they were able to use that to structure and guide the AI in the solutions, as well as to make some of that transparent to people so they could start to see these really complicated yet well-researched and fairly well understood relationships. And that was just kind of mind-blowing to see that in action. Really, I think helps highlight, the quality of the science and the depth of the science behind some of these findings. I also got to judge. We haven't announced the winners yet, but I can say that I expected a lot of like really kind of business focused like solutions to come out of it, and there was one, but 2 of the 3 finalists were actually focused on the connection between built environment, natural environment, and health. So it was really cool to see people rising to the challenge and like thinking big.
Well, it's incredible, and I'm going to go off script a little bit because I'm naturally curious about whether or not you've noticed that health has taken more of a central role in Climate Week. especially given both Anthony and Arnab, your presence there and your connections and your work on climate and health and climate and tech. So I'm curious, maybe Anthony, if you want to start us off in responding to that, and then we can pass it over to Arnab.
I mean, it certainly has for me. I'm coming at this from built environment perspective. So I think there's a much bigger understanding that I see in the community of people who like build buildings or build infrastructure, how what they're doing isn't just about maintaining a level of service. It's actually part of a system that helps people survive and prosper. Just to give you a quick example, the other thing that active role I had was moderating a panel on Thursday evening with the team at the MTA, which runs all of the buses and trains in the New York City region, all of their sustainability and resilience folks, leaders. And health just kept coming up everywhere in what they were talking about, even though what they were talking about was keeping the trains running. So we've had a huge problem with cloudbursts and flooding of the train system. And, they are spending billions of dollars trying to manage how runoff during storms enters the system, gets pumped out of the system where it goes. And they're one of the biggest factors that impacts how much sewage ends up getting flushed into the city's waterways during a sudden downpour, so what they call combined sewer overflow. So yeah, what the MTA is doing about stormwater has a direct impact on the health of the waterways and anyone who's exposed to that. And then their long-term sustainability is all about transit-oriented development. So trying to cluster housing and services around transit stops, which, as we know, just is hugely interconnected with walking and all the health benefits of walking, access to food. It's all part of a system of restructuring cities to be both sustainable and healthy. So, I think that's, to me, those connections are becoming very, very clear to people as we get into a more mature stage of the climate fight.
Thank you. Arnab, any observations about health being more of a pivotal topic during Climate Week?
Yeah, it's funny. Anthony mentions this the combined sewer system. So on Thursday evening, in a separate event, I was at the American Museum of Natural History, and I gave a public talk under the big blue whale, which was a highlight for me. First, I wish I brought my kids, to be honest. And what was interesting is that we had these public lectures to just the general audience, and the combined sewage system came up, as well as sort of this. What was the most interesting part of the conversation, I felt, was a discussion by a historian or a couple of historians who spoke about how cities have historically dealt with heat waves. And it's this combination of how health is intimately related to the built environment, the built form. And they raised this wonderful anecdote about how in the 1940s, I can't remember which year it was specifically, there was a series of heat waves that were quite problematic, and a lot of people got sick. And it was just very uncomfortable, to the point where a lot of public pools were installed in New York City, all around the city, large, I think 40 or 50 Olympic-sized pools. Although don't quote me on the number, because I don't remember off the top of my head. And it kind of ushered in this new idea that we need to create the public infrastructure to keep our citizens cool, and that cities could do that, and they've done that in the past. And I think for me that highlighted the intimate connection. Danielle, and sort of riffing on Anthony's point, I definitely think there has been a maturation of health in Climate Week compared to last year, and there's definitely been brought more to the forefront. I'm a little biased because I only, as a physician who cares about and studies climate, I tend to get invited to these more. So I wasn't as aware what's happening in the other spaces. But that said, I think the future is going to move into the space that Anthony describes, which is where we start having these conversations together and seeing how the built environment does influence health and what needs to be done together, and how we can eventually protect individuals from those risks of floods, not just today when they happen, but in the future and heat waves and alike. So I definitely see this as moving ahead. And I also think it's a more cogent story to tell. And I think that people are getting to that and understanding that we may have differences of opinion about about climate change, but when you are physically hit by a 110-degree day and it's 100% humidity outside, that's just very uncomfortable. And we don't sleep well, and that has implications for our health. And I think this is a nice way of bridging this gap. And I think that's what we're seeing.
Thank you. Because another question that comes to my mind, and Arnab, I'll start with you, but I think after observing Climate Week, and you both have attended multiple times or over multiple years, and do you think that there's a need for Climate Week, especially in its traditional form, or should we start to look at alternative ways of bringing folks together to talk about these issues and try and develop solutions?
Well, I think given the current environment generally and the shift away in priorities, I think bringing attention to these issues is critical. And so I don't see a downside for bringing attention to this during Climate Week. And as I think you mentioned, the General Assembly sits at the same time, and there is cross-pollination of ideas and an understanding. There's discussions at an international level about frameworks that we need to develop. And then I think what we see, at least as what I've seen, is how these frameworks kind of trickle down into how we understand how nations can operate, but then how states and regions, and then how cities who are really looking at this problem firsthand need to address climate and its impacts. I think there's an old adage in climate and health. It's not that old because I think this is a new debate, but a lot of the impacts are contextual, right? You focus on different things in New York City versus, say, Phoenix, Arizona, versus Miami, Florida, versus the Northwest. And so that interaction between these global platforms and how we interact at the day-to-day level need to happen. And I think that Climate Week allows for that. I will say that I think the future of this work should bridge more the opportunities between what communities are seeing and doing and what's happening sort of amongst industry and finance and at the national or subnational level. I was sad not to be able to attend some of the events in parts of New York City, like in Sunset Park or down in the Lower East Side or in the South Bronx, where they're directly addressing these problems with a lack of urban greening, with air pollution emissions and raised or increased asthma exacerbations, and how communities are organizing and using the political process or even outside the political process of addressing these concerns through community-oriented action. And so linking those two things together, I think, is going to be a critical part. And I hope to see that in the next iteration of Climate Week. I think I would see that as really a maturation of these ideas, of bringing the global to the local.
Thank you. Anthony, any thoughts on the current way that Climate Week occurs and whether or not it should change before jumping to audience questions?
I think it has changed. It has been copied in other cities, so you don't have to get on a plane and burn, like unbelievable amount of carbon to get to New York in order to participate. Like, I think Miami, LA, Berlin, like there are lots of other cities that do either like satellite climate weeks or other times of the year. And a lot of it happens. There's a lot more remote participation options as well than there were in the past. But I think like scale matters, and you actually get increasing returns to scale. This has become a bit of like a kind of golden rule of urbanization over the last 15 years, pioneered by some physicists who started looking at how cities grow a few years ago, and basically, they did the math, and the bigger an urban network gets, the more productive it is and the more creative it is. And so, having 1,000 events produces, more than 10% more climate action than last year's 900 events did. So I think like for this big one to keep growing and, as you were saying, sort of wrap around the General Assembly and really almost like overshadow it, I think that's a great trend. I would like to see that continue. And then the second thing is the contrasts. Like I had a particularly jarring set of transitions this week. Monday night, I went to an event it's run by venture capitalists and a finance guy who covers climate adaptation now for Wall Street. And it was all about basically how much money we're going to make, selling and scaling the technologies of climate adaptation. And then the next morning, Arnav, I was at your session, which right before your panel was 3 Black mayors all talking about how their resilience grants had been canceled by the federal government. The resilience grants they were going to use to collect the information they needed to protect people's health. And so it's like, the capitalists are getting all the data that they need to protect their assets, yet, the most vulnerable communities are not getting the data they need to protect their people. And that's like, I probably knew that, injustice was there, but seeing it and feeling it and interacting with the people who are experiencing it was pretty intense. And then, the next day I was at a bunch of like stuff with international NGOs who just fly around the world collecting mayors, and I'm not sure what they actually do. And then the next day was downtown in Chinatown at a loft with people who I think are planning the next revolution. So it's that, diversity of viewpoints that I think really makes it a unique experience. And, getting to Arnav's point, like, can the connections happen? And that was something I didn't feel happening as much as I would have liked to see. And I guess that's where like leadership comes in. Somebody has to start to pull those threads together.
Yeah, I think that ties in nicely with the question from the audience. So the question is, what are the top climate health risks this decade, and how should developing countries sequence mitigation and adaptation in health systems to deliver the biggest near-term gains, which I think connects well to the panel you mentioned, Anthony, of, the data is not going to the people who are most vulnerable.
Yeah, I would pitch this question to Arnav, who's the expert on this.
Yeah, it's a hard question to answer because your climate and health risks depend on where you live. I think predominantly, again, everything is somewhat contextual. I think, I don't want to use that as an excuse not to answer the question, so I'm going to do my best to do so. I think obviously the ubiquity of heat and heat risk is particularly problematic. In parts of the world where it's already hot, they're getting hotter. And so even acclimatization may not be sufficient. As we frankly just butt up against the idea, there are physiological limits at which people can exist, particularly doing the day-to-day work that they do, outdoor workers or travel or even indoor workers. And I think what we classically call hydrometeorological events, sort of flood risk, the nuisance rains or nuisance floods, or versus hurricanes and tropical storms, are always an increased risk, and they're becoming increasingly more. The second part of the question is interesting. How should developing countries sequence mitigation and adaptation? And I'm going to try and answer this in a way that hopefully answers the question, but also addresses the broader issues. I think the reason why I was at the museum on Thursday night was I'd worked with members of the Biden administration on their climate resilience healthcare toolkit. And the idea of this toolkit was to help healthcare systems prepare for future climate risks, what to do in terms of their built infrastructure, how they manage populations that the healthcare systems care for, how can they survey some of the risks, and then also start developing strategies of how to pay for that adaptation and mitigation. And I've historically not been a person who focuses on mitigation, partly because, as a physician, I've seen the effects and I want to address and adapt to them. And I want to do the same for my patients. But one key thing I learned from this experience of working on this toolkit was you kind of have to do both at the same time. And that any methods of adaptation are actually can be mitigation. When you have to invest so much money into changing fundamentals of how processes in the healthcare system go, or if there's a massive power outage and a lot of people come into hospital during a heat wave, you have to prepare adaptively, but also potentially that gives you an opportunity to see how can we provide healthcare more sustainably. And so both those opportunities exist, and I think they can exist at the same time. How developing countries can sequence this is a harder question. I think the concerns that I have about a technocratic solution sort of make me wonder that low-tech solutions inevitably play a role here. And I think I gave a talk at the hackathon where I talked about some of the challenges when electricity goes out and what you can actually do, and your healthcare delivery. And I always worry about that situation. This was the case with Hurricane Sandy, where most of Lower Manhattan was knocked out because the Con Ed power infrastructure was flooded. And so, when I think about developing countries and the sequencing, and I honestly prefer the term LMICs, I think about places like Bangladesh that have dealt with ongoing flood risk because of their location, right in the delta of the Brahmaputra and the Ganges, the constant cyclonic of activity that takes place there, the history of millions of people succumbing to flood risk in the context of that, and how they had to deal with this through just a sheer volume of their effects. They've using low-tech solutions with healthcare workers, communicating risk, using nature-based solutions to protect flood against flooded areas, and using these means to address healthcare system risk. So that's just one example, but there's many others.
Yeah, I would like to chime in on this. So I had a really interesting conversation with a Ghanaian entrepreneur, a guy named Fred Swaniker. He runs it's an IT consulting company called Sand Technologies. They do a lot of work in healthcare and urban tech as well. And he was talking about some stuff they're doing with AI healthcare in Africa. And the reason I think it's relevant to this conversation is that, like, I can't remember the number he gave me, but I think it was something like, in the US, there's one doctor for every 50 patients or something like that. And in Africa, the least developed parts of Africa, it's like 1 in 20,000 or something, right? So there is not a health system in many parts of these countries. And I think, going back to your point earlier, Arnav, about the carbon impact of AI, like that's where we should spend it, right? Like building out healthcare in places, if it's possible, to do it there. And so, like, I would probably push, at least in the health systems, the mitigation priority deep down. That's the place where I think the developed world owes a lot of carbon debt to the developing world and should spend it there. We can, reduce carbon in transportation and construction and all the other things, deforestation, before we have to start making hard choices about health systems. That's just my 2 cents.
And I'm glad that you mentioned the environmental impact of some of these technologies, and I'd love to hear both of your perspectives, especially Arnab. You mentioned earlier that it gives you pause to think about the environmental impact of these technologies, and so is there a right level of balance in these types of innovations that have an impact on climate and the environment? And while there is a good role for them in terms of making our healthcare systems more efficient and simplifying some of these processes, what are some of those other concerns associated with these types of innovations and technologies when it comes to climate and health.
Yeah, I think it was interesting how I agree totally with what Anthony said that if we're going to be using these technologies and expending the extra carbon to do so, maybe we should be thoughtful about what use cases we focus on. And I think that one concern I have in listening to some of the discussions this past week was that we were conflating sort of the broader use of AI with AI in healthcare. And because AI's impact far exceeds the fact that we use it in healthcare. And actually in healthcare, I think like most technological developments, we have to be very clear about what the benefits are and who potentially loses. For example, you don't want to misdiagnose someone or, because that has grave implications on people's health. But it has less of a concern if you're creating, a story. This is clearly not my area of expertise, but if you're using it to build new devices or create new content for YouTube or your Insta or your TikTok, it has a different implication. And so this sort of tacking on to the end of what is the value and what value could it bring to the specific case, I think is an important consideration. And if we can prove, for example, that you're going to impact and improve life expectancy, reduce hospitalizations from heat-related harm because you can better identify individuals, I would feel that would be a good use case for expanding that. But these other cases I worry about. And some of the conversation was that AI in general shows this, and then using the healthcare example as an example of why it's good. But I think you kind of have to tease them apart because they're not the same thing. And I think this is a debate that needs to mature as well and say, well, if we can prove that you're, for example, reducing administrative burden and all that, yeah, I can see that being a useful case. Now, that is not to say, and I say this as a doctor who writes a lot of medical notes and sits up past the wee hours, finishing my paperwork, that maybe we could also figure out a better system of operationalizing that. That doesn't require AI. There are simpler ways of reducing administrative burden, I think. Nonetheless, I think that making that distinction, how could these technologies be better used to identify risk, to identify opportunity for improving health, are clear benefits. Whereas I kind of wonder about the broader implications.
Anthony?
Yeah, this discussion makes me think about a pretty awkward conversation I had during Climate Week. It was a meeting of a group of multilateral organizations that all try to network cities together to share knowledge around climate solutions. And they've all been at it for 15 or 20 years. They're very well established and incredibly effective. And they're launching a new university-led research effort to develop yet another case study library that will be a resource. And I sat through the presentation, and it basically sounded to me like a better funded, bigger version of what they've been doing for the last 15 years, which is they collect stuff from city leaders, they have grad students write up the case studies, they publish them as PDFs, and what they were outlining was like a marginal increase in the amount of information that they were going to provide. And I looked at it and said, I don't know how long it would take, but I'm pretty sure that we can get AI to do that, at a scale 100 times what you're doing, faster, possibly better, and if not better, at least giving all of you experts, allowing you to be experts more, and review these and get more information out there. Basically let the experts do the expert work, not the grunt work. And I gently tried to share, that's sort of how things are moving in a lot of fields, how they're moving in industry, and instantly just very, very fierce pushback about the carbon footprint of using AI to do that. And I didn't get into it, but it's 50 grad students produce a lot of carbon emissions. Like these are like complicated accounting exercises, and we were kind of losing sight of like what's the output and the impact. Like, would 50,000 case studies be more useful than 500? Probably. But yeah, it was really jarring to me that opportunity to use AI to really accelerate what these organizations are trying to accomplish was not it wasn't just that it wasn't immediately welcomed, it was immediately rejected very forcefully. So I'm trying to think about like what are the arguments to counter that, and like how do you get that message through in a way that people can at least consider using the tool.
Yeah, I think that it's difficult to reconcile that, especially in, I guess what we hear in the media, right? That has an impact in how people perceive these things. And so there's been a lot of reporting on the health impacts of the use of AI just from the data centers and the energy that's needed to support that. And so I think that it's hard to sum up in one key takeaway of these very nuanced and complex issues and challenges.
Yeah, I mean, I guess what I'm saying is like all the delegates at Climate Week also made a decision about whether to get on a jet airliner, and drop a couple kilotons of CO2 because it was for a larger purpose, and they are the only ones that could do it. Like there's costs and benefits to all climate action, even in terms of carbon. And yeah, I guess what I'm getting at is that the narrative around AI and the environment has gotten so toxic, and rightly so. I mean, it is a massive impact, but it's also a moving target. Like it's changing every day. And I think like what would be more effective would be to send a signal back, but these are the things we want to use AI for, and like we need you to make it more energy efficient so we can continue to do so. And oh, maybe the things that you invent to serve us could serve the people who are using it, to make Instagram photos.
Yeah. And there's a great question posted in the chat of, with hearing about these impacts of AI, especially the environmental aspect of it, and the way that the world is going, have we passed a point of no return? Like the AI train has left the station and we're just on it or not, so to speak?
I mean, I don't think anyone can predict anything about AI. It is incredibly volatile, like technologically, market-wise, society-wise. But it is a new set of capabilities that, like, I think people in this field need to engage with because it has like a lot of potential to help, empower the work.
Yeah. And also reflecting on what some of these scientists were saying in this panel, it is clear to me that we still need to understand the impacts, and these impacts also are unstable. And I think about the positive impacts, but also and the potentially deleterious impacts. Unstable, they're sort of evolving, and we get to understand it. And this is such a fast-moving target that arguments like this is going to improve your work efficiency, I think may not be the case. And I know, Danielle, you teach. I do a little bit of teaching. Anthony, I know you teach. The extra work required to correct or read through, manuscripts or papers that are AI written or informed, right, actually may add more work to you, because it creates more need to invigilate what you're doing and make sure that there's some robustness and some fairness applied. And so it opens up these broader questions. And the social scientists who I think gave a great presentation talked about that. Is that he actually created more burden for people because they had to correct and make sure the work was that the tools weren't hallucinating, for example, because they could have implications for people, some livelihoods, and that struck me that these things are happening, and that there's added burdens or new burdens that are presented. And so understanding that, I think, is a critical part of this evolving landscape.
Mm-hmm. Yeah, I think that's a great point. And just to kind of take us in a slightly different direction, since we're getting close to the end of the hour, were there any innovations that either of you heard about this week, or solutions that were brought up during the sessions that you attended that you were really excited by?
I can share one. So the Finance Bro event that I went to on Monday night, there were 8 pitches by startup companies. A lot of them were doing like risk analytics stuff, for big asset owners. But there was one company, they were called Eztia, EZTIA, that were manufacturing a new. It was some kind of like aerogel type woven fabric. I'm sure I'm murdering this, but it was basically like a fabric for shirts and headbands for outdoor workers that would allow them to just expel like massive more amounts of heat during the day. I think it basically like they described it as sort of like accelerated sweating or enhanced sweating. And they had, I don't know if it was like kind of clinical grade tests, but they had claimed to have quite a bit of evidence that it really allowed people to withstand much hotter and more humid outdoor work environments safely and comfortably. And then there was another company that did a pitch about a material that was it was a kind of green concrete. And just the two of them together, it was a nice kind of contrast to all of the software and data stuff. Although I'm sure there's tons of AI used in inventing these things. But it really kind of showed like the material world changing in a way that was going to be beneficial, to helping us deal with changing climate in terms of health. So that was pretty remarkable.
Yeah. Arna, were there any things that jumped out to you
Yeah,
in
I would
terms of
say innovations in the sense of some new wonderful product. But I would say that I saw more environmental justice teased in to the narratives that were being presented, which I thought was critical to understanding who's most affected and how to address it, how to address these challenges. And I also saw sort of a broader attempt. I wouldn't say that it succeeded, because I think we have to see if time will tell, but how the narrative needs to be presented about climate action. And we think about the idea of the doomsday sort of apocalyptic vision of 50-degree, 3 degrees Celsius increases and 50-degree weather. The application of indigenous knowledge and respect for it in some of the ways of thinking forward, re-encapsulating the ideas. I say this as an urban greening kind of guy, of solidarity, what we call anthropologically as multi-species solidarity, understanding not just the persons in the world, but the world they live in, alongside issues of biodiversity, the plants we share the world with, and how we're kind of all in this together and need to solve this as one in unity. And I thought that's actually reframing. It kind of took a lot of things from the outskirts of the conversation about justice and critical inquiry and climate change in general into more of the mainstream. And I think that speaks to the importance of issues like nature-based solutions that are coming to the fore and have been promoted. The mayors who spoke the other day talked about this, how they plant rain gardens, for example, along highways to prevent flood risk. And I think this just speaks to an evolution of these ideas. And I found that incredibly insightful and innovative and exciting.
Yeah, I mean,
Great. Well,
just to build on that, like, I think one of the things that comes out of the higher prominence of like the adaptation and resilience conversation, I mean, it's more prominent because we're feeling the effects more intensely, so it's on people's mind. Um, but the nature, it's also like very, very empowering because the nature of adaptation and resilience work is incredibly distributed, right? I mean, mitigation is like find the 10,000 biggest polluters, shut them down, and you've done like a big part of the work. You know, a lot of the other things are important, but like the big fight is shutting down the big polluters, and that's, you know, that's a corporate government like international NGO philanthropist game. For adaptation, like half the adaptation spending right now is being done by consumers. Like this is something that people have to do to protect themselves and their homes and their communities. And so, like, I think both of these things sort of are happening together for a reason, because you've got new voices like making themselves heard, because they're feeling the impacts, and they need to do something about it. So it's both like more urgent and more hopeful in some surprising ways that I think are like really promising for kind of keeping people moving forward.
great. Thank you. And after hearing about those innovations and some of those takeaways from this week, what's next for each of you? Anthony, what are you planning to do with these new insights? And are there any actions that you intend to take after this week?
So for us at the Urban Tech Hub, we are moving towards our own event, which we think of as kind of like a follow-up for the people who didn't get enough time talking about stuff in Climate Week. It's called the Urban Tech Summit. We do that November 11th and 12th at the Cornell Tech campus in New York City. And this year, for the second year in a row, we're focusing on the intersection of AI and urban climate adaptation. So we'll definitely be carrying that thread forward.
Arnab?
Well, I got to meet a lot of folks I've worked with but never seen in person, which is wonderful. And so it's been continuing those conversations and sort of seeing links where, honestly, people doing similar work than I do in my research. And it's kind of linking arms and saying, hey, what can I learn from you? What can you learn from me? How do we bring this to bear at scale? And so, yeah, there's plenty to come. Super excited by the prospects.
Great. And one final question. Did either of you interact with anyone from the UN in your sessions?
I met with a few folks from the it's a climate change body of the UN, the UNCCF, I think it's called. And so we would it seems like even I think the plan is COP30 is at Berlin and in Brazil. And so the conversation about climate and health are actually growing in prominence there. So and that's no one necessarily from the state governments or like prime ministers or presidents, but people who are doing the hard and important work sort of behind the scenes.
Yeah, I shared a table at that meeting about the case study project with a bunch of UN Habitat folks, and they're big stakeholders in that kind of knowledge dissemination work, and they were interested in what I was talking about using AI to harness that. So I was intrigued by that.
Wonderful. And it looks like we don't have any further questions from the audience. So I think I'd love to, thank you both for taking the time to share your insights from the week and to talk about your experiences at Climate Week. Before we end, is there any final final statements you want to make to those watching remotely?
I would just say if they're considering it, they should come to New York for Climate Week or find a Climate Week event, in their community and participate.
Yeah, and I think the university has a fair number of events as well. So the Cornell Atkinson Center, the work we do with the Environment Defense Fund, and a whole host of other events. So there's plenty of opportunity if you're interested.
Great. Well, thank you both so much for joining us this afternoon. And I thank you for the work that you do, and I hope you continue.
Thanks, Daniel.
Thanks, Daniel.